Ebola is spreading, rebels are killing, and eastern Congo is being pulled into a deadly double crisis. As militants massacre civilians and force families to flee, health officials warn the violence is sabotaging efforts to contain a dangerous outbreak. Is a humanitarian disaster now spiraling out of control? An Ebola outbreak is spreading through the Eastern Democratic Republic of the Congo. But health officials now face a second and deadly challenge, escalating rebel violence that is disrupting efforts to contain the disease and protect vulnerable communities. More than 30 people have been killed in a series of attacks around the city of Beni, one of the centers of the current Ebola outbreak in the Democratic Republic of the Congo. At least 10 people were killed in raids on the villages of Matete, Mamuli, and Kitoho during the early hours of Wednesday. The attacks have been blamed on the Allied Democratic Forces, or ADF, a militia affiliated with Islamic State that operates in eastern Congo. According to community leader Isaac Kavalami, homes and motorcycles were set on fire during the raids, while a number of civilians were also abducted. The exact number of those kidnapped remains unknown. The latest violence follows another major attack carried out by the ADF in Beni on Saturday night. Witnesses reported that more than 20 men, women and children were killed after militants entered the city shortly before midnight. Residents described scenes of panic as families fled into surrounding bushland to escape the violence.
People continue to die innocently in the Beni region. People continue to die innocently in the Ituri region. In Irumu, we ask the government of the DRC to find a solution to these massacres and to protect the people and their property as the Constitution, the mother law of our country, requires. We call on every authority to play its role to protect the people and their property.
The attacks come at a critical moment for the region, which is battling the 17th Ebola outbreak recorded in the Democratic Republic of the Congo since the virus was first identified in 1976. As of Wednesday, health authorities had recorded 344 Ebola cases and 60 deaths across North Kivu, South Kivu, and Ituri provinces. The violence has already begun to interfere with the public health response. North Kivu's military governor said 3 patients who had tested positive for Ebola fled treatment centers in Beni following Saturday's attack. Health workers and community leaders warn that population displacement caused by the violence could increase the risk of further transmission. As residents flee affected areas, authorities face growing difficulties enforcing containment measures and monitoring potential infections. Civil society activist Albert Lucin said communities are struggling to cope with both the Ebola outbreak and ongoing attacks by the ADF. Lucin, who says he has lost 20 family members in ADF attacks, warned that fear and insecurity could undermine efforts to build public support for Ebola response measures. Researchers say the ADF has intensified attacks on civilians and security forces in recent years. Civil society organizations estimate that approximately 10,000 civilians have been killed by the group since 2014. The Congolese government has condemned the latest killings and reaffirmed that defeating the ADF remains a national priority. Congolese and Ugandan forces continue joint operations against the group in North Kivu and Ituri. Meanwhile, the World Health Organization has warned that insecurity is severely hampering efforts to contain Ebola. WHO Director General Tedros Adhanom Ghebreyesus recently said that isolating patients and building community trust become nearly impossible in areas affected by ongoing conflict. They came to burn it down, and when the flames took hold, the patients ran. Angry residents attacked and set fire to a treatment tent run by Doctors Without Borders in the town of Mongwalu, at the epicenter of Congo's Ebola outbreak. As staff fled the blaze, 18 people with suspected Ebola infections escaped into the surrounding community. Their whereabouts remain unknown. It was the second such attack in a week. Days earlier, a treatment center in the town of Rwampara was burned to the ground after residents were prevented from retrieving the body of a man suspected to have died of Ebola. The hospital director in Mongwalu, Dr. Richard Lokudi, was unequivocal about what the attacks meant for containment.
We strongly condemn this act, as it caused panic among the staff and also resulted in the escape of 18 suspected cases into the community.
Burials have become a flashpoint. Ebola victims must be interred under strict protocols because their bodies remain highly contagious. Families prevented from conducting traditional funeral rites have pushed back hard. In Rwampara, on May 23rd, armed soldiers and police were required to escort Red Cross workers in protective suits as they lowered sealed coffins into the ground, while crying relatives were made to watch from a distance. Red Cross team leader David Basima said his team faced significant resistance and had to call in security forces for protection. The scale of the crisis is growing. There are now 750 suspected cases and 177 suspected deaths across Ituri province. The WHO has upgraded the risk level for Congo to very high and says the true number of infections is believed to be significantly larger than confirmed figures suggest. The Bundibugyo strain driving the outbreak has no approved vaccine and no specific treatment. The United States moved on May 22nd to ban green card holders who have recently been in Congo, Uganda, or South Sudan from re-entering the country, citing the need to ensure screening and quarantine resources remain available for US citizens. 18 people are now somewhere in the community around Mongwalu. Health workers do not know where. But with treatment centers under attack, distrust growing and suspected patients disappearing into the population, health officials fear the outbreak may be slipping beyond containment. Authorities have now banned funeral wakes and gatherings of more than 50 people across northeastern Congo. It spread for weeks before anyone noticed. By the time the alarm was raised, it had already crossed borders. A deadly Ebola outbreak is spreading rapidly across Eastern Democratic Republic of Congo and Uganda, raising fears that global aid cuts may have delayed the response and allowed the virus to spread unnoticed for weeks. This Ebola outbreak is unlike anything the world has seen from this virus in years. It is caused by the rare Bundibugyo strain, named after a Ugandan region where it was first identified in 2007. There is no vaccine for it. There is no specific drug to fight it. It kills roughly 1 in 3 of those it infects. As of this week, at least 139 people are confirmed dead, and more than 600 cases are suspected, according to the WHO, which has declared an international health emergency. The delayed detection has raised uncomfortable questions about what enabled it. Initial laboratory tests returned negative results because they screened for the far more common Zaire strain, not Bundibugyo. Armed groups displaced civilians in eastern DRC in early 2025, allowing the virus to travel untracked. Then there are the cuts. US epidemiologist Eric Feigl-Ding, who was among the first scientists to flag the emerging COVID-19 outbreak in January 2020, was direct about what he believes happened.
USAID used to have this when it was on the ground, giving out medication and funding local healthcare workers and clinics to do this. Now, USAID is gone. This is clearly one of the examples of what happens when you decimate the healthcare infrastructure in a lot of these countries.
Under the Trump administration, USAID had 90% of its budget cut. Elon Musk, then head of the Department of Government Efficiency, admitted in February 2025 to having accidentally terminated some Ebola containment programs. The CDC also lost 25% of its workforce under Health Secretary Robert Kennedy Jr., including key Ebola staffers who were fired and then rehired. The US formally withdrew from the WHO in January 2026, ending contributions that had totaled over $1.2 billion in 2023 and 2024 alone. Julie Drouet, Country Director of Action Against Hunger in the DRC, told DW that the resource reduction had consequences.
The reduction of resources in the DRC, both humanitarian and health-related, is inevitably harmful for the Congolese population, and to some extent for epidemic prevention and detection.
The World Health Organization has released an initial $3.9 million emergency package. But health experts warn that a far greater international support will be needed to prevent the outbreak from escalating further.